This week we are going to be discussing two aspects of HIPAA, the privacy and security rules. Hopefully you've already looked through the websites provided on the Week 5 tab and have a pretty good understanding of this information already. This is something you will be seeing every single day as you work as healthcare administrators, and you'll have to review it at least annually, probably biannually. So it's good that we get a basic understanding of it now. Alright, so let's just start with the basics. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. HIPAA was established in response to the increase in electronic health record platforms and was designed to help individuals keep their information secure and prevent misuse of private medical information. This was a landmark measure because it impacts every single healthcare practitioner, payer, and patient in the United States. It has undergone many adjustments and changes since its creation, but it has successfully been implemented throughout the healthcare community. One small note, please make sure you're using the correct acronym, HIPAA, rather than HIPPA. I've seen it misused a lot, and I even used it incorrectly myself back in grad school, but it's important that we get it right because we're professionals, and you will definitely face a lot of flack if you're spelling it HIPPA in the workplace. Today we're going to look at the two basic facets of HIPAA, the privacy rule and the security rule. The privacy rule is the portion of HIPAA which addresses the individual's rights over his or her medical information and the use of that information by providers, payers, and healthcare organizations. The security rule addresses the responsibilities of the healthcare organizations, payers, and providers to protect electronic protected health information, or EPHI. Now, like I said, the privacy rule addresses the individual's right to have his or her medical information kept private and secure. HIPAA is at the same time very flexible and very strict. HIPAA allows insurance companies to communicate directly with providers and healthcare organizations and allows providers to work with other providers freely. However, HIPAA dictates that any interaction between any professionals regarding private health information must be relevant and is at the discretion of the patient. Releases of information, or ROIs, are required in most settings, and even then, patient information can only be accessed when it is absolutely necessary, and only the information which is needed for that particular service must be accessed. You can't just see anything that you want. This is why the privacy rule is often referred to as the need-to-know rule. The best example of breaking this rule I can give is when Britney Spears was hospitalized several years ago after her crazy head shaving incident. While she was hospitalized, the facility found that her file was accessed over 100 times by hospital staff, most of whom did not even provide care to Britney. This was clearly a violation of the HIPAA privacy rule because even though staff had consent to access the patient's medical files, they did not need to know any of that information. So they were pretty flagrantly violating this law, and a lot of people were fired. So while you might not have a celebrity at your facility, you'll run into similar situations quite a bit as health administrators. It is extremely important staff only access that information which is pertinent to the current situation and only with patient consent. The HIPAA privacy rule is so important because it protects not just our patients but ourselves as well from improper use of medical information. The privacy rule gives patients more control over how and when their medical information is used and helps prevent malicious or unnecessary access to information. The HIPAA security rule is a lot more rigid than the privacy rule. Security rule addresses the standards healthcare organizations must maintain in regards to how electronic health information is stored and protected. The security rule is continually updated to address technological advances and changes. Recently, the security rule has been expanded to cover the use of things like tablets, smartphones, and texting, and new regulations have been passed to regulate the use of these methods of communication with patients. The security rule is important because it forces organizations to maintain best practices and continually update their health management systems. This reduces the likelihood that health information will be accessed by an outside entity or manipulated by an internal threat. Breaching HIPAA carries huge consequences. Not only can organizations be investigated and fined, but those responsible for specific intentional acts breaching either of the HIPAA rules can face jail time. Any organization you work for is going to regularly train their staff on HIPAA compliance because the risks of inadvertently or negligently breaking confidentiality are extremely serious and could impact the financial viability of an entire organization, not to mention the impact on patient perception if a HIPAA breach is made public. HIPAA is an issue you will face again and again as health administrators. It is extremely important you have a very clear understanding of its role in managing health information. Ultimately, it helps keep you safe, both as an administrator and as a patient.